Following the withdrawal of the over 600 private hospitals affiliated with the Rural and Urban Private Hospitals Association, or if you prefer the acronym RUPA, and the suspension of services for patients covered by the Social Health Authority, SHA, a day ago, key stakeholders have come out urging the government to consider reverting back to the NHIF and abolish SHA and SHIF. Thioma Sharia with the details.
October 2024, to replace NHIF, the Social Health Authority SHA has been faced by significant challenges, including system failures and the latest one being unresolved debts from the NHIF era, with private hospitals owed 30 billion shillings for services rendered as far back as 2017. The crisis exposing deep flaws in the transition now threatens to destabilize decades of healthcare progress. Speaking over the matter, former Machakos County Attorney and Advocate of the High Court James Kathili has urged the national government to consider health as a key subject to its citizen and therefore revert back to NHIF and abolish SHA and SHIF.
It has come to public knowledge and it has now reached what we call public notoriety that this thing is not working. We have seen many patients in many institutions, that is medical institutions, who are complaining that they are not receiving funds as is being proposed. And in other cases, then what SHA or SHIF is catering for is so small compared to the bills that are being demanded.
Kathili cites lack of public participation as the main elephant in the room regarding the implementation effectiveness of SHA.
One of the challenges and the issues I've always had with this thing is public participation was not conducted, and yet this is an issue. This is an issue that affects every other Kenyan. Let them come and give you their views. You might think some of them have nothing to say, but you'll be shocked at the nature and the kind of evidence and advice they're going to give you. So please, now that this thing seems to be putting Kenyans in great difficulties, I opine that let it be set aside. Let us go to a system that has been working, that is NHIF. We could even have what we call pilot counties to run this thing and see whether it is working, what are the challenges.
Just a day ago, over 600 private hospitals affiliated with the Rural and Urban Private Hospitals Association RUPA temporarily withdrew their services for patients covered by SHA, citing unpaid government arrears amounting to 30 billion shillings and systemic failures in the SHA framework, leaving teachers, police officers, and other public servants stranded without access to critical care.
Appointments that will be made subsequent to Monday, unless there is a concrete effort by government to solve this issue, only those appointments after Monday shall be affected.
According to a survey by RUPA, 89% of facilities reported daily system crashes, delaying claim submissions. 83% of hospitals could not confirm patient coverage due to missing data, and on dependent registration, 59% of dependents' records vanished from the portal. With the current crisis facing the healthcare sector, one that threatens the government of the day's legacy, stakeholders are now proposing the use of parliamentary appropriations to settle 30 billion shillings NHIF arrears, an overhaul to the SHA model, MAKL contract review, and upgrading SHA's integrated healthcare technology system. Thioma Sharia for KUTV.